For more than a century, visiting nurse associations have been providing home health care to the communities they serve. Today, the role of VNAs is more important than ever. As the population continues to age, patients spend less time in the hospital, and the demand for home health care increases.
This is a line of work where you really get to use all of the things that you have learned, all your skills and your judgment in a way that you cannot in a facility. You're not confined by being constantly interrupted when you're trying to have a conversation with the patient, by bells ringing down the hall and an x-ray coming to take your patient away. You can actually spend some quality time with that person and the family, and you can accomplish so much more.
Well, I think it gets people out of the hospital and keeps them out of the hospital, which is a very good thing, because hospitals, we all know that things can go wrong in hospitals. They're dangerous environments in terms of infectious disease problems, and so if we can get people out of the hospital and allow them to convalesce in the home environment with good nursing supervision and care, then I think patients do better.
It's easier because they know what their foods are like, they have loved ones where there isn't any restrictions, and when they get to see people, whereas in a hospital they're on somebody else's timetable.
If a patient goes into the hospital, there's very little education time that a nurse can give because of the amount of time that a patient is usually in the hospital and the patient load that the nurses have. So the physicians look to us as an extension of them by giving education.
We get a lot of patients that don't have any idea about their medicines, how to take them. It is because they're not in the hospital long enough and the nurse has not had any spare time to do any of the teaching there.
Our nurse goes in, assesses, opens every case, ensures the patient is safe, and then case manages and follows that patient, talking with the family if they're up north, if they're local, talking with the physician, with the specialists like the cardiologist. That nurse is in there and on the phone and knows what's happening with that patient.
I think that's the big difference in the VNA. They have very, very well-trained nurses, and they're not afraid to call and communicate, which help me keep my patients healthy, keep them out of the hospital.
When the patients come back to my office, they ask intelligent questions. They ask what changes can I make in assisting their care and improving their quality of life too.
The Visiting Nurse Association of Florida has been providing quality, compassionate care to Florida residents since 1976. In addition to skilled nurses, the VNA also provides physical, occupational, and speech therapists, medical social workers, home health aides, dietitians, and companions. Much of the agency's success can be directly attributed to its leadership, beginning with our founder, Patricia Crow, who remains a member of the board of directors, to our current CEO, Donald Crow. Their vision and dedication have led to the continued growth of the agency. Patricia and Don's vision includes staying at the forefront of technology, coupled with unsurpassed continuing quality education for their caregivers. But as critical as they may be, technology and education are a small component of what makes the VNA a leader in home care. What really sets the VNA apart is its knowledgeable and caring staff.
For me, it was like coming home. I've been in home care for about 20 years, and when I came to the VNA, it felt right in my heart. It really was. It was something that the people that were around me were so welcoming, and it meant that we were caring for people, and I really liked that.
I am amazed by the level of competence and the level with which we run this business. It is the smartest, most amazing group of people I've worked with. We make it very fun. I love what I do. I have a lot of passion about what I do, and it's nice to work with others who feel the same and who are really incredible.
It's great because we have a lot of support. The support system comes all the way from the top, and it's more like a family than it is an actual company.
The VNA is also unique in its ability to give back to the community through its charitable organization, the Visiting Nurse Foundation. The VNF allows the VNA to provide assistance to patients who are unable to provide for themselves. Since its inception, the VNF has provided over $1 million in services and assistance to residents of Florida.
I had a patient that weighed pretty close to 520 pounds, the best weight they could get on her. And this lady had been in bed for 2 years, not able to turn, not anything, and she was only 40-some years old. The day that she got in that lift chair that the foundation brought for her, I'll never forget it. It was like she had brand new shoes and clothes. I mean, she looked good.
Most recently, the VNF funded the VNA's Florence Nightingale Express Mobile Health Clinic. Named after the original visiting nurse, Florence travels the state providing blood pressure clinics, flu shot clinics, school-age physicals, and can be pressed into service in case of an emergency or natural disaster.
I think it's a wonderful idea. I think the use of it for influenza immunization programs and outreach programs is really the true benefit. There's an enormous resource in being able to get that vehicle out into the community, to all the communities that the VNA provides services to.
We see the patients, we perform certain laboratory tests right in the clinic, and we spend a lot of time educating the patient or the patient's family member.
The Visiting Nurse Foundation is funded by charitable donations as well as fundraisers that help support our vision and mission. These fundraisers include an annual appeal to current and past patients, the VNA Golf Tournament, which draws over 75 golfers annually, and the VNA Air Show held on Veterans Day weekend in November. The air show attracts nearly 75,000 guests each year and provides high-flying fun and games for every member of the family.
We love the air show, and we think what they do there is a tremendous service to the community in many ways. But it also is important to remember that the purpose of the air show is to raise money to provide care for the indigent members of this community.
The air show is a lot of fun. It's a lot of fun for us, but it's also a very good event because I know that the money that we get from that air show and the money that we raise is going back to the community.
The Visiting Nurse Association of Florida offers the most comprehensive series of quality programs and services available in Florida, and an unrivaled staff of professionals to help implement them.
Visiting Nurse Association has 3 nice programs that we have been using out there now. One of them is the congestive heart failure program. The patients on this program feel so much better knowing about their disease, and they can find help quicker by calling the doctor when they see a little bit of weight gain. They know when to call. They know the signs and symptoms, and they feel like they belong on a program.
Our chronic lung program, we're very fortunate to have a respiratory therapist who can evaluate the patient both at admission and at discharge to see how well the patient's doing and how well they're doing with their equipment, like oxygen.
The benefit of the balance program is to prevent the patient from falling. We try to teach them the tools that they need to stay at home safely and be independent, continue their life, and be able to keep that socialization and independence.
The only one I would recommend was the VNA. They are the best that you can get. Like I said before, they're reliable, they're well trained, very caring, and they're a moment's notice, you call them, day or night, whatever it may be, they're there for you. And that will assure you that you're going to be taken well care of.
Well, the VNA, I've been with them for over a year, and they have been just absolutely wonderful to me. They've helped me so much. I would not be walking today if it wasn't for them.
But I look forward to the nurse coming from VNA, because it's just like having another person in the family. It's so good to us and always follows through on any of our problems and gives us a lot of support mentally and physically.
Quality of life really affects all of us, and we want to do the very best for our aging, needy population that have all of these special needs.
The standard was set over a century ago. For the past 30 years, the VNA of Florida has carried on the tradition of providing care to those most in need. The Visiting Nurse Association of Florida, improving home health, improving lives.